The Japan Medical Association, the country's largest association of doctors, issued an emergency request to Japan's capital to enhance urgency surrounding the COVID-19 surge. The head of the association, Toshio Nakagawa, called on people to work remotely and complete vaccinations for people aged between 40 and 64, in a televised address on Thursday. "We have to take all the measures to avoid the explosion of infection and medical system goes under strain," Nakagawa added. "As a person who is engaged in medicine, we'd like to issue our emergency statement to the government. We hope this will be reflected in the future measurement." The association also urged the government to make more vaccines available to the public. Tokyo reported a record number of new cases Thursday for the third consecutive day, adding 3,865 new cases. Nationwide, Japan reported 10,385 new cases, the first time the country has topped 10,000 new cases since the pandemic began. This comes as the Games continues full steam ahead, nearing the end of its sixth day of official competition. Tokyo 2020 has reported 198 cases linked to the Games so far. Medical care systems are on the verge of collapsing in some regions in Japan amid the ongoing surge in the number of novel coronavirus infections. If the current situation continues in some areas in the northern prefecture of Hokkaido and the Tokyo metropolitan region, there will be a grave impact on the local health care systems and it will become impossible to save lives that could have otherwise been saved, a health ministry panel of experts warned at a meeting Tuesday night. A member of the panel said, "We can't say whether we will be able to maintain the current medical treatment systems after 2 weeks. There is a huge gap in the crisis perception between the government and medical workers on the ground," the member added. Echoing the panel's view, Toshio Nakagawa, head of the Japan Medical Association, told a news conference Wednesday that the medical service system is on the brink of collapsing. The pace of the increase in infections is particularly fast in Hokkaido, the Greater Tokyo area, the Kansai region, including Osaka Prefecture, and the Chubut region, including Ika Prefecture, he said. "It's becoming difficult for medical institutions to treat patients other than those with the coronavirus," Nakagawa said. According to the ministry, the occupancy rate for hospital beds for COVID-19 patients exceeded 25% in Hokkaido, Tokyo, and 7 other prefectures as of November 18. 9 of the country's 47 prefectures are under a Stage 3 alert for the virus, the second worst level under the nation's 4-tier warning system. The expert panel member noted that the spread of the virus is faster than was expected, stressing that the situation for hospital beds is changing from moment to moment. "I fear that offering treatment to both coronavirus and other patients at the same time will become more difficult in less than 2 weeks, the member said. On Tuesday, the government said that trips to Sapporo, the capital of Hokkaido, and the city of Osaka will be temporarily excluded from coverage under its Go to Travel tourism subsidy program. But the panel member said that the review is too late. The panel's meeting on Tuesday night took place amid a grievous atmosphere, the member said, noting that there were major gaps between the government and medical institutions in their views over the present state of the nation's medical services. "Now is the time for the entire nation to consider imposing restrictions on people's movements and the shortening of business hours at eating and drinking establishments," the member said. "These measures may not be sufficient, though." Another member of the panel said that hospitals cannot easily increase the number of beds and that some medical institutions cannot provide treatment due to manpower shortages even if they have enough beds. Medical institutions are in a more serious situation than the government.